Good morning, everyone. Hope you're all doing well today. Welcome to today's Public Health Committee meeting. Today will be voting bills out of committee, and I just want to welcome everyone. And it's really wonderful. We have a group of students here with us in the room, and we're so happy to see them here with us as they are the people who will be helping to take care of us into the future. So with that, I will turn it over to Senator Anwar.
Thank you, Madam Co-Chair. I also wanted to welcome everyone who's here, and hopefully we'll be able to move forward with some of the important bills. And wanted to welcome the pharmacy students from St. Joseph's College. Welcome. Looking forward to having conversations with you later. Thank you. Back to you, Madam Chair.
Thank you very much, Mr. Co-Chair. Appreciate that. Representative Claire DeStitria.
Good morning, everybody. Thank you, Madam Chair, and welcome, everybody.
Wonderful. And I know, as is always the case, and we always like to make sure that people know this, there are many meetings happening here today in the building, many voting meetings and other meetings that people have. And we know that members, including our good ranking member, Senator Summers, will be in and out. We will hold votes open today. We'll announce the time as we get a little bit farther into the meeting, but we certainly will be holding votes open today. So with that, we will begin. We're moving on to item number 3, bills to be considered for JF action. And the first bill on our agenda is Senate Bill number 1326. This is an act concerning the Department of Public Health's recommendations regarding food safety and oral health. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second? Seconded by Senator Marks. This bill sets the fluoridation level at 0.7 milligrams per liter, which is the current level recommended by the U.S. Department of Health and Human Services. And this applies to water companies serving populations of 20,000 or more. And this bill also stipulates that the U.S. FDA food code in place on December 31st, 2024, will serve as our state's model food code and will not automatically change with changes made at the federal level as it has in the past. However, the commissioner may adopt any published food code supplement coming from the FDA. And is there discussion on this item? Representative Claire DeStitria.
Thank you, Madam Chair. Just for some clarification, what is the reason for not continuing in the path that we currently do with the FDA, and why do we have to put it into statute and not just continue with the recommendations of the Health and Human Services Committee?
Thank you for the question, Representative. I think the decision has been made to stay with that level that's been in place since, I believe, the 60s. I may be wrong on that. But for many decades, this has been the level which we in Connecticut have used, which has also been tied to that federal standard. And given some of the discussions at the federal level and the uncertainty if there would be changes to this, we felt that it was prudent to stick with what we know, where all the science is, where the research is, where the evidence is of what has worked, and make sure that we just know that this is what we're doing in our state to keep those same levels in place.
Okay, thank you, Madam Chair. It seems like we've done this for many years, and this is another preemptive bill that we're going to pass when we've gone with what the Health and Human Services have recommended in the past. But thank you for that clarification.
Thank you very much. We're seeing some changes at that department, which, one of which we heard from NCSL this week. The Department of Health and Human Services is no longer going to be requiring public comment on a number of their items. So I think this is one of the reasons why, again, sticking with the evidence that we've seen. And I was reflecting on this at home with my husband. We heard many dentists sharing testimony that this is what they recommend. And we were talking about the fact that it would seem dentists might want to have more work for themselves. Not that they would, but meaning that dentists, in essence, by recommending this, are saying that we don't want to be providing this kind of service. We want to be able to make sure that we're keeping our residents healthy. Are there other questions or comments on this item? Senator Almore.
Thank you, Madam Chair. This is an important bill. This is a priority of the Department of Public Health, and it should be the priority of the Department of Public Health. It's worth mentioning that we have had fluoride in our water in the right quantity, which has been proven by scientific data. And it's no secret that the Health and Human Services at the federal level has said that they will change that. It's in public statements that have been made that is going to have an effect. Essentially every scientific community in Connecticut and beyond agrees that the levels that we have in the state of Connecticut right now are the safe ones. There have been data that a very high fluoride level has been associated with IQ effect on children, but that is 3 times more than what is the acceptable level. And this is studied in great depth. And then during the public hearing, we had experts who had testified, their written testimonies that are available as well. The current law that the state of Connecticut had was that we will follow what the Health and Human Services recommendations are. But Health and Human Services in the recent past is saying that they will no longer abide by the scientific data, and therefore we will have to have our data that we know from the scientific basis, and that is the reason for this bill. So that there's no confusion, this is based on the scientific data for the United States prior to December of 2024 that we've been following. And then going forward, we have been informed by people in positions of responsibility at the federal levels that they will no longer abide by the scientific data. Therefore, being advocates for public health, this committee is taking the responsibility and with the guidance of our Commissioner of Public Health and the entire Department of Public Health with this. So that's the rationale for this for anybody who is confused. Thank you so much, Madam Chair.
Thank you very much, Senator Anwar. Representative Reddington Hughes.
Thank you. I mean, I'm just curious as to what percentage of, people that are being served through the water supply in the state of Connecticut have this in their water right now.
Thank you for that. I believe we're somewhere around 2/3, but I can verify that number. So at this 2/3 to 3/4, this bill will only cover systems serving 20,000 or more residents. Thank you, Representative. Further questions or comments? Seeing none, Mr. Clerk, would you kindly call the roll?
Senator Anwar,
Yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton,
Yes.
Senator Marks,
Marks votes yes.
Senator McCrory, Senator Summers, Representative Claire DeStitrio,
No.
Representative Berger Giovanni, Representative Biggins, Representative Carpino,
Yes.
Representative Dauphiné.
No.
Can you do that one more time?
Rep. Dauphiné votes no.
All right, I have it. Thank you. Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Jenga, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon, Senator Hockadell, Representative Cavros DeGraw, Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Mara, Representative Martinez, Representative Morin-Bello, Representative Parker, Representative Pauletta,
No.
Senator Rahman, Representative Reddington Hughes,
No.
Representative Ryan,
Representative Ryan votes yes.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis. Madam Chair, we're all good.
Thank you very much. And again, we will hold votes open likely until 3 o'clock, but we will confirm and clarify that as we go through the meeting this morning. Thank you very much. The next item on our agenda is Senate Bill number 1373. This is an act requiring the licensure of lactation consultants. This is a JF to the floor. May I have a motion? Moved by Representative Belton. Is there a second?
Second.
Seconded by Senator Anwar. This bill is a bill that actually passed out of the House last year aimed at supporting people who are breastfeeding. And it creates a licensure category and requirement for lactation consultants who are certified by the International Board of Lactation Consultant Examiners, IBCLE, which is an independent body, and makes clear that only those who have been certified by the IBCLE may refer to themselves with the title lactation consultant. This makes the distinction between lactation consultants, which are often referred to as IBCLCs, as opposed to a peer educator, lactation counselor, breastfeeding educator, or peer counselor. In addition, practitioners who are working within their scope of practice and lactation consulting students who are under supervision remain able to provide lactation consulting as long as they do not refer to themselves as lactation consultant. Doulas, midwives, community health workers, and those who work within lactation education and support in the WIC program and other public health professionals may continue to provide education, support, and counseling, but may not refer to themselves as lactation consultant or IBCLC. The bill also confers typical licensure authority on the Department of Public Health to provide both enforcement and monitoring, and it goes into effect July 1st of 2026. Is there discussion on the item? Representative Clara DeStitria.
Thank you, Madam Chair. So if this bill passes and becomes law, if I'm a current CLC, certified lactation consultant, will I no longer be able to call myself a certified lactation consultant?
Essentially, this bill says that if you are licensed as an IBCLC, then you have the ability to call yourself a lactation consultant, but otherwise you do not have the ability to call yourself a lactation consultant. It does not preclude CLCs who are certified through a different certification process from practicing, but does preclude them from using the title.
Thank you for that clarification. So follow up to that, what will they be able to refer themselves as?
I think that the language, it's a difficult thing because of the nomenclature, excuse me, and the name of the certifying body. And I acknowledge that. I think lactation peer counselors, educators, and some of the other language that I actually referred to a moment ago, I'm just looking at my notes, lactation support, lactation education, lactation counseling.
All right, thank you for that clarification, Madam Chair.
Thank you very much. Other questions? Representative D'Amico.
Thank you, Madam Chair. That was a nice segue into a couple of my questions. I'm looking at the testimony that was submitted to the committee on this bill and remembering some of the oral testimony that was given and listening to this discussion. I think the overarching problem here is that this bill, by its very language, creates more confusion than it clarifies, and I think that's the biggest problem with this bill. I understand that lactation issues in general are very important. It's a big issue. I will never deny that, but I think this bill actually creates more confusion than clarification. And it's not just me saying that. We had at least 3 people who are in this field of lactation consulting submitted testimony saying basically the same thing. The language that's in here now creates confusion. And if I may, Madam Chair, I'm just going to read a sentence or two. One person who is in the field said that licensing IBCLCs creates unnecessary burdens for the most skilled providers while allowing those with lesser credentials to practice. Now, understandably, they can't practice with a specific title, but they're still going to be able to practice. They just can't call themselves they can't call themselves licensed, but they're still going to be able to do what they're doing. It creates confusion for the public, it seems to me. The other issue the other issue that came up, and maybe it's not even worth talking about, but we probably should, has to do with Medicaid reimbursement. So there seems to be some question as to whether the passage of this bill that creates a licensure would actually allow lactation professionals to obtain Medicaid reimbursement. I don't think that's been clarified yet either. So I think there are two big problems. It creates confusion in the public. And just to take that one step further, one of the people who testified said, and I'll just read it to you. If someone is able to practice as if they are equal to an IBCLC, why would anyone become an IBCLC? If you can continue to practice, just as long as you don't use the magic word that you're not allowed to use, you're still going to be able to practice. So why would you go through all the time, expense, and trouble of getting this licensure? I think it's problematic, Madam Chair. So anyhow, I've said enough. Thank you.
Thank you for that. So a few thoughts in reflection. As we have in other areas of medicine, we have different levels of practice. And the IBCLC level is a different clinical level. It's a different educational level that requires science courses and certification, clinical practice. It requires being able to have people observe and to go through that peer process. And we do need CLC. We do need the people who have the CLC certification. Again, there are others with other nomenclature for that certification, but we need people to provide at different levels. Much as we have LPNs, we have RNs, we have APRNs, we have physicians, and they practice at all different levels and bring different things to the table. In terms of the Medicaid reimbursement, this bill would not automatically allow reimbursement. That's something the Human Services Committee will have to take up, and there is actually a bill in Human Services this year. There's no guarantee that there would be reimbursement. However, CMS, which is the national organization, has said that licensure is a necessary step in being able to receive that reimbursement. I will just share something from another piece of testimony that was shared with us, that in 2011, then the Surgeon General then did call for the licensure of the IBCLCs. And I think another piece of that was the American College of Obstetricians and Gynecologists, often referred to as ACOG, defines lactation personnel as follows, and I'll read this. Clinical lactation professionals providing clinical care include, but are not limited to, licensed lactation consultants, the IBCLC, and that's actually with the trademark, certified midwives, certified nurse midwives, certified professional midwives, nurses, physician assistants, nurse practitioners, and physicians. Lactation personnel providing counseling, education, or peer support include lactation counselors or breastfeeding educators and peer supporters. So I think that to the earlier conversation that I had with a good ranking member, I think the nomenclature is difficult, and I would liken it to social workers, actually, in DCF. So for many years, in many places, people were called social workers, but they did not have the designation of, or the title, the MSW, for example, or a BSW. They were people working in the role that was titled social worker. And in our state, we did do some work to actually clarify what those things were. So it is something that's a change. Certainly, to the point about licensing, as is the case in many other fields and professions, people have different feelings about licensure, what it means, whether it's a plus or a minus. That's the beauty of this. We have the chance to debate whether that makes sense. This bill and the intent behind this bill is to assure that we provide a pathway for access for the level of clinical breastfeeding support to people needing that support from all different backgrounds. And we need to make sure that they have access to the broad range of support services that are out there and in the ways that make the most sense for them.
So If I may, Madam Chair, so I appreciate that, and I certainly would not want to stand in the way of a pathway for people to attain licensure in this field or any other field. And you said something about assurances. Could I have the chair's assurance that the language of this bill will be worked on between now and the time that it hits the floor, the House floor? Is it House?
So Representative, thank you for that. What I can assure you is that we will remain in conversation. What I will say is that we did pass this bill out of the House last year. So there's always room for more conversation. And I cannot guarantee that there will be changes to the language in order to be able to address all the concerns, because there are competing concerns. So that's the difficulty that we have with it. So what we're going to do, I can absolutely assure you that we will be sitting down with members of the opposition to this bill, with members who are supporters of this bill, with members of this committee, leaders of this committee, and talking with people about how we can best move forward to make it less confusing for people and to really clarify and understand. There are different ideas about how to get to this. And as we see in testimony, both within the IBCLC and the CLC designation, there are people with different opinions. Senator Marks to be followed by Representative Dauphiné.
Thank you, Madam Chair. So I do struggle with this bill a little. So can you, and I'll just background, I did work maternal child health for years. I helped people breastfeed as a visiting nurse that went into people's homes when they came home, moms and babies. We were called the moms and babies nurses. And I had a child with a cleft lip and palate, so I relied on a lactation consultant. Back in the old days, we just called everybody lactation consultants. And I'm one of 8 children, and lots of us, lots of babies, and we've all, right? It's not easy always. Some people, it is easy. You can have one baby, it's easy to breastfeed, and another it's not. And the people that are lactation consultants just can absolutely make that most precious time. And, it's the most amazing time bringing that new baby home, can make it or break it. So I think about the lactation consultants out there that have been doing this for decades, and I don't care what kind of education they have, their work experience will just make them, at times, not always, but at times, some of just the best lactation consultants out there, because they've seen everything, right? I mean, you can read about something and learn something about in a book, but when you actually have to help somebody breastfeed a child with a cleft, it's completely different than just reading about it, because it doesn't always work like that book says it's going to work. So what is the reason for having this bill? Like, how is it going to really change somebody's lives? And you talked about there's a difference between LPNs and RNs. Well, there is a huge different scope and practice between what an LPN can do and what an RN can do, right? There's the Nursing Act. I mean, there's a huge scope and practice. Is there a different scope, like in practice, between the IBCLC and the CLC, or are they both able to do the same thing? And so there's 2 questions. Why are we doing this bill? And is there a difference in the scope?
Thank you for the question. And again, similarly, your remarks about people who have been doing this for many years do remind me of the conversations that have happened related to social workers and some of that child welfare work. Very, very similar. So I'm sensitive to that. We don't seek to define the scope for the peer educators and supporters. There are differences of opinion related to that. In this bill, this seeks to talk about scope for the IBCLCs. But to your question about why are we doing this bill, there are different motivations for different proponents of it. But I will say, for me, the CMS ask for licensure in order to be able to have reimbursement for IBCLCs is a huge motivator. And what that means is that those who are IBCLCs would be eligible to be reimbursed and to provide that level of clinical care and experience to people all at all levels and with all different kinds of healthcare.
So, so if you do if we do pass this legislation, then the IBCLCs will be able to bill insurance companies for coverage?
That's the hope and intention. I specifically to Medicaid, obviously, we here in this committee are not making that decision here today with
Yeah.
this bill.
And how many other states have licensure for, do you know that?
I don't off the top of my head, not too many.
Okay, I'm still, okay, I appreciate you so much. Thank you.
Thank you very much. We have Representative Dauphiné to be followed by Rep. Reddington Hughes.
Thank you, Madam Chair, and thank you for the opportunity to speak on this. I am opposed to this bill for many reasons, but I will say that the testimony on this bill, was overwhelmingly opposed as well. And I think that our good representative earlier talked about the confusion. There's much confusion, much frustration and angst amongst the IBCLCs and the CLCs, and I honestly don't understand why we're here today to pass a bill for this that we might get the insurance coverage. That seems to be the impetus for it. And it's a big might. We don't know, a big what if. And I would just urge everyone to just not support it at this time. I think it's premature until we know that it would be covered, and that would be a different conversation. Thank you.
Thank you very much, Rep. Dauphiné. I think we find ourselves in a bit of a chicken and egg situation with our human services colleagues. Representative Reddington Hughes.
Thank you. My question has to do with the designation of these titles themselves. If the purpose of this bill is to see if the IBCLCs are able to be reimbursed through insurance, what precludes us from keeping that IBCLC designation and leaving the certified lactation consultants to be on their own? I mean, I just can't understand why we have to change the name in order for them to be eligible to be reimbursed.
I think is your question, why are we
Why are
using
we going
consultant
to-
only
the
for those?
IBCLCs, they will be the only people that will be able to be considered certified lactation consultants. And everyone that is seen in that view today will have to call themselves, I don't know, Miss Lactation. And, I just don't understand why we need to change titles in order for them to be eligible for reimbursement. Through you, Madam Chair.
Thank you. I think the main issue is that we are seeking to license the IBCLCs. And the reality of the current nomenclature is that they both have that consultant title. So the licensure category would only apply to the IBCLCs. Senator Elmore. Let me just ask Representative Reddington Hughes, were you done? Okay, thank you. Senator Elmore.
Thank you, Madam Chair. Madam Chair, I'll try to see if I can make the situation a little less confusing for people. There's a difference between the two professions. They're both dealing with lactation. The level of training for a CLC is approximately 45 hours of training, 5 hours of training. For IBCLC, it's 1,000 hours of training, including clinical training that may take up to a year. So 45 hours can not take up to a year of clinical training. It's a sit down learning about the process. And yes, they may have had training on their own by being in the field, but that is not formal training. So now for them to be able to say that 45 hours are equal to 1,000 hours of a structured training is unfair. And so that's one thing that I think should be clarified. It is going to clarify it even further if the one who has had a formal training and spent 1,000 hours to become an expert on the field, they should be licensed. That's also some clarification. So this bill is not confusing, it's clarifying things. It's very clear that there's a profession and there are people in the profession. Now, does this mean the CLCs are not important? Absolutely they are. They will remain a part of the maternal bundle. It's not taking away anybody's job, but there's an opportunity for independence in complex cases. And those complex cases are cleft palate or a child who is already very weak or poorly nourished. They may need extra help. And their mothers who may have underlying illnesses or conditions that would actually restrict. So from a public health lens, and this is what this committee is about, public health, the children's nutrition in the first few times of their life, weeks and months and year of their life, is so critical. That is going to actually change their future outcome, their nutrition, their immunity. Everything is about the nutrition in the first few months to years. And therefore, we need to make sure that there's a structured system in place for the women who are going to have difficulty with their children's nutrition. And that's why you need a profession and you need sustainability of that profession. So we have a responsibility in the public health to give a license. That's our responsibility. Now the payment and the insurance, that's another world, but at least we feel there's a separation. It doesn't take away from the other profession. It is, and hopefully we'll have another conversation on the CLC licenses in future. But at this time, the conversation is how can we take care of the children, and IBCLCs are far more trained to be able to do it. So hopefully this will clarify some questions, and I would expect and hope that people will understand and support this, because end of the day, it's about the nutrition of our children, not about scope issues. Thank you.
Thank you, Senator Anwar. We have Senator Summers to be followed by Representative Kitt, to be followed by Representative Gilchrist, to be followed by Representative Dauphiné.
Yes, good morning. I wanted to speak on this bill because I don't necessarily agree with the direction that we're going. CLCs have been in practice for many years. There's over 400 of them. There's very few IB CLCs. The CLCs, as you heard in the testimony, most of the testimony on this particular bill was not positive for going forward with the IB CLCs. CLCs have been caring for mothers and babies and making sure babies have nutrients, as Senator Anwar has spoken for years and years, and they do feel that this would be an unlevel playing field, that they would be pushed out of the field to be able to provide their services. And this is particularly difficult in our underserved communities where we are already having difficulty with helping mothers nurse their babies. And if we are to take nearly 400 people out of the market, so to speak, that would lead to, again, needs that cannot be met. So I am not supportive of this bill moving forward. I think that the IBCLCs are a great resource, but I also think you can't discount the CLCs and their years, many of them decades of experience that they have with mothers. And they strongly feel that this would really impact their ability to serve their communities. So I am against this bill today. Thank you.
Thank you, Senator Summers. And I will make clear that the intent of this bill is not to preclude our CLCs from practicing. Representative Kitt to be followed by Representative Gilchrist.
Yes, again, I think I just wanted to clarify, one, that nobody is going to be prohibited from practicing, but two, the prerequisite of being licensed to get reimbursed by Medicaid, that decision is a federal decision. Is it about needing the licensure, or is that just a state thing to get the Medicaid reimbursement?
Thank you for the questions, Representative Kitt. The CMS, that's a CMS recommendation.
At the federal level.
That's a recommendation from them, yes.
Yes. So, okay. So the clarification is we're doing this because the federal guidelines say we need this licensure, or these practitioners need this licensure to bill Medicaid. So it's not that we are doing this arbitrarily. Thank you. I just wanted to make that clear so everyone knew that this was not something we're just doing to penalize CLCs over IBLCs. Thank you.
Thank you, Representative Kitt. And I do believe the good co-chair of the Human Services Committee and our Public Health Committee member, Representative Gilchrist, may be able to speak a little bit to some of this as well.
Yes, thank you, Madam Chair. I speak in support of this bill. I think there is a great deal of confusion around this proposal. In no way does this try and remove CLCs from doing the work they've always done and the important work they do. IBCLCs, as it has already been explained, have a longer education and a different certification. And it's my understanding they are only used in certain instances when a parent might need a higher level of attention and care. Currently, our Department of Social Services has established what is being called the maternity bundle, and CLCs are able to practice under that bundle. In order for an IBCLC to be reimbursed, paid, covered, as we've talked about, at the amount of money that they'd need to be reimbursed, this will help them to be able to do that independent of the maternity bundle. What we've heard at MAPOC and in our Human Services Committee is that individuals from lower incomes are currently unable to access an IBCLC because they can't have the Medicaid coverage. And so we actually want to address that disparity in care by licensing the IBCLCs so that more people can access that level of care if they should need it. If they don't need that level of care, they can still access the CLC or the LC. Yes. Okay. Thank you.
Thank you very much, Representative. Representative Dauphiné.
Thank you, Madam Chair. Thank you for the indulging me for a second time. I just want to say again, the IBCLCs did not want to be licensed. A majority of those that testified, they weren't asking for this, and they weren't making the argument about education versus being less educated. It was about the insurance coverage, which again, we don't even know it's going to be covered after all of this. And I think the unintended consequences that could come of this are going to be just not beneficial to this bill. Thank you for allowing me for the second time.
Thank you, Representative Dauphiné. Seeing no further discussion, Mr. Clerk, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes no.
Senator McCrory, Senator Summers,
Summers votes no.
Representative Clarice Deetria,
Clarice Deetria votes no.
Representative Berger Gervalo, Representative Biggins, Representative Carpino, Representative Dauphiné,
Rep. Dauphiné votes no.
Representative D'Amico,
D'Amico passes.
Representative Elliott, Representative Jenga,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon, Senator Hockadell, Representative Cabros DeGraw, Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Mara, Representative Martinez,
Representative Martinez votes yes.
Representative Morin-Bello, Representative Parker, Representative Pauletta, Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Yes.
Senator Slatt, Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis. Okay. And then I'll go through the list again. Senator McCrory, Representative Berger Gervalo, Representative Biggins, Representative Carpino, Representative D'Amico,
Representative D'Amico passes.
Representative Elliott, Senator Gordon, Senator Hockadell, Representative Cabros DeGraw, Representative Kennedy, Senator Kushner, Representative Mara, Representative Morin-Bello, Representative Parker, Senator Rahman, Senator Slatt, and Representative Zupkis. All right, we're all set, Madam Chair.
Thank you, Mr. Clerk. Votes today will be held open until 3 p.m. So make sure you come by then, up to the public health area. Well, I'll remind that again. I'll remind everyone again, at the end. Senator Anwar?
Madam Co-Chair, can I clarify a question? When the votes are open, somebody who has passed on a bill, can they change it?
If you've passed on a bill, you have an opportunity to vote until 3 o'clock. Yes.
Thank you-
Okay.
Thank you, Madam Chair and Mr. Chair, for that clarification. Thank you.
You're quite welcome, Representative. Moving on to item number 3, Senate Bill 1451. This is an act concerning recommendations of the working group to study staff safety issues affecting home health care and home health aid agencies. This is a JFS. To the floor, LCO 6259. May I have a motion? Moved by Senator Anwar. Is there a second? Seconded by Senator Marks. This bill is really an update to what we did last year here in this committee in Senate Bill 1. And just give me 1 second. Thank you. So it updates the home care safety provisions. It adds certain requirements for hospice agencies, including monthly assessments and reporting to DPH on clients' threats or abuse. It requires providers to share intake information when referring clients to home health agencies or home health care. And it makes clear that the potential DSS enhancement payment for timely reporting of workplace violence is happening within available appropriations. And finally, it requires agencies to report threats or abuse against staff members by happening from anyone, not just from clients. The S language that we have before us removes hospice agencies from section 1 of the bill, which is the intake information collection. Is there discussion on this item? Representative Martinez.
Hi, I'll be voting yes today, but I am hoping that in the future we can look at adding some language to this bill that would allow the trainings that are monthly to be more open and accessible for nurses. I know our monthly meetings have a Zoom option currently, and I think especially for home care nurses, that would be really helpful to be able to have it go out electronically via Zoom and open that up. I think that would be an important piece. And I am looking forward to working with members on this committee in the future to hopefully keep making things even safer for our healthcare workers and getting them the resources that they need to do that.
Thank you, Representative, for raising that here. I think that is something that we will be discussing with leadership. We wanted to get this bill moving and did not have the chance to finish that conversation. So thank you for raising it, and we're glad to have you here on this committee to do that work. Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to start a consent calendar and add this item, and I don't remember, do we need a motion for that?
Thank you very much. You know, we can go ahead and do that now, and that way when we vote on it. So is there a motion for a consent calendar? Moved by Representative Clara DeStitria. Is there a second?
Second.
Seconded by Representative Martinez. Thank you very much. Okay. Oh, Senator Anwar.
Thank you so much, Madam Co-Chair. I just wanted to thank the advisory group and the working group that has worked countless hours of volunteer time since we passed Senate Bill 1 in 2024. That allowed us to start to look at this in more depth. We were able to make significant changes. We had an unfortunate death in our state, and more than one death for healthcare workers, and the number of cases of physical abuse, emotional abuse, and sexual abuse for home healthcare workers during the testimonies in 2024 were very painful. And this is the fastest growing segment of healthcare needs that are there in our state. And we needed to make sure that we can promise our healthcare workers and the next generation of healthcare workers that they will be safe to provide the best care to anyone who needs that care. And this committee was continuing the work that was started by this Public Health Committee. And then this group has come up with recommendations, and we appreciate their volunteer work and their expertise and their wisdom that is allowing us to go to the next level. And this will be a journey, but we are improving every single year and moving in the right direction. And this is just home health workers, but we want to make sure every healthcare worker is going to be protected in our state in these troubling, difficult times with people going through too much emotional and other challenges. Thank you, Madam Chair.
Thank you very much. Representative Clara DeStitria.
Madam Chair, I was told I need to make a motion to add this item to the consent calendar.
Okay. So you've moved.
I make a motion to add this item to the consent calendar.
Okay, seeing and hearing no objection, this item will be added to the consent calendar, which has been moved and seconded. So when we vote, we'll be all set for that. But thank you for making that motion, Representative. And I would like to just concur with the remarks from Senator Anwar. I know that all of us on the Public Health Committee greatly appreciate the time, effort, and care that those who served on that working group have put in, as well as our Public Health Committee team who helped support that. So moving on to item number 4. This is House Bill number 6977, an act concerning the Department of Public Health's recommendations regarding drinking water. This is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Anwar, seconded by Representative Jenga. This bill requires the department to adopt regulations related to on-site sewage disposal systems. It authorizes the commissioner to issue policies and procedures while in process towards those those regulations, and update the technical standards. This is in response from a statute that was passed to move from the department, from DEEP to DPH, the authority over systems with capacity between 7,500 and 10,000 gallons. This bill also codifies the current practice about the review and approval of new public water sources, and it makes a technical change regarding the timing of the license renewal for bulk water haulers. Is there discussion on this item? Representative D'Amico.
Thank you, Madam Chair. I don't have any huge problems with this bill, but as I'm sure you're aware, the Rivers Alliance has some significant problems with this bill. And I'm looking at their testimony, specifically with regards to sections 2 and 3, and having to do with regulation and oversight of subsurface sewage systems. And they point out, well, let's go right to the lines 73 and 74. 73 and 74, the commissioner may implement policies and procedures necessary to implement the provisions of this subsection while in the process of adopting such policies and procedures as regulations. So the Rivers Alliance, in their testimony, they are questioning that. And they're saying that if the DPH, I'm just going to read from their testimony if I could, if the DPH is concerned that the process of adopting and developing such standards and regulations will take longer than the deadlines required in statute, the agency should ask for more time. This policy and procedure authority will only make it more difficult for local health directors. So I'm just wondering, did that certainly got my attention, just wondering if it got the attention of the chairs.
Thank you, Representative. And I did review the testimony. We all have, I'm sure, but the regulations are in process right now. So there are regulations, both DEEP and DPH, that are in the public comment period. They appear to be moving forward in a timely fashion. There is no guarantee ever in any process. And as such, because this is such an important public health issue, the department has asked us to allow them to have policies and procedures in place in the event that that conversation doesn't go the way it is. And as you may know, we are one of states, I believe, or maybe 2 in the country that has a legislative body that also requires approval of those regulations. So it's a public process and there are votes involved. So I think at this point, that was the reasoning, being able to provide policies and procedures. Thank you, Representative. Representative Steinberg.
Along the same lines, for clarification purposes, this is effectively a one-off. This does not necessarily establish any new capability for the agency to prolong decision-making in other areas. Is that correct?
This is policy and procedures related specifically to the regulation of the 7,500 to 10,000 subsurface sewer. I always get the nomenclature wrong on this, but it is specific to this.
I just want to make that clear that we're not establishing a new power for the agency. We are addressing a short-term immediate need.
Correct. We have to specify in statute when we give that ability. Let me just make sure online. Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to add this item to our consent calendar.
A motion has been made to add this to the consent calendar. Seeing and hearing no objection, this item will go on our consent calendar. Moving on to item number 5 on the agenda, House Bill number 7080. This is an act concerning neuromodulation treatments for veterans at the University of Connecticut Health Center. This is a JF to appropriations. May I have a motion?
Madam Chair, I move this adoption.
Moved by Representative Jenga. Is there a second? Representative Belton. Senator Onwer, I'm going to turn it over to you. Oh, I'll turn it over to Representative Jenga.
Thank you. Just a few comments. I think Connecticut is a patriotic state and we all care about our warriors. I feel it necessary to come together to take a multidisciplinary approach to help solve the problems of veteran suicide. 22 a day is not acceptable. House Bill 780 will leverage UConn's health existing infrastructure to establish a neuromodulation center that will be available immediately. After neuromodulation surgery, each patient will receive intense 6 weeks, 90-minute sessions of occupational and physical therapy at Hartford Healthcare. This groundbreaking neuromodulation procedure and therapy is not available at VA hospitals. Neuromodulation therapies have emerged as promising interventions for conditions such as chronic pain, post-traumatic stress disorder, and mobility impairments, all of which disproportionately affect our combat veterans. Over 60% of our combat veterans fall in this category. The FDA-approved device implementation procedure has already shown exceptional results. Dr. Chris Connor of UConn, a worldwide leader in this procedure, has already noted functional improvements 2 to 3 times greater than previous research. Interest in this program has greatly expanded, giving Connecticut the unique opportunity to be the leading neuromodulation center in America and possibly the world. The need for more research on this innovative treatment is underscored by UConn's commitment to help, where they will contribute resources to this pilot project by reducing costs of MRIs, EEGs, and professional fees. Improving the health of our veterans makes fiscal sense also. Improved outcomes reduce hospitalizations, skill supportive care, and dependence on medications. It is time we move proactively to help our veterans rather than reactively when health complications occur, or even worse, when it's too late and there's veteran suicides. Let me give you an example. Current stroke survivor improvement are considered to plateau after 1 year post-stroke. If full recovery is not reached within this time, whatever debilitation remains leaves the patient feeling depressed and potentially hopeless, which increases the risk of suicide. Veterans who risk their lives for our country deserve more than this. They deserve the opportunity to see the results would allow them to gain activities such as cutting their own food, tying their shoes, and even more preciously holding their grandchildren without fear of failure, of falling. Such improvements were made with retired U.S. Navy Captain Ronald A. Beasley, who suffered a massive stroke and 14 years later underwent neuromodulation treatment. This is a great example of returning him to as a functioning independent and living a life of dignity. By passing this one-time funding request, Connecticut will help veterans such as Captain Beasley regain control of their lives and enjoy the retirement they rightfully deserve. So I ask this committee to vote to support this bill and by extension, our veterans. Thank you.
Thank you, Representative Jenga, and thank you for your advocacy and work on this issue. Senator Anwar.
Thank you so much, Madam Co-Chair. And I wanted to also echo your comments for Representative Jenga for his advocacy work with the veterans and also looking at this issue with so much depth and also passion. For the benefit of others, I just want to make a couple of comments on this issue. People have heard about the term EEG. When people look at the electrical rhythm of the brain, it's quite surprising. Well, there's electrical rhythm in the brain. And then that rhythm changes in different parts of the brain depending on what activity is happening. And those, in the same manner, there's an opportunity to put electrical wiring to specific parts of the brain to be able to improve their functioning. And what we have learned in this new era of medicine, neurosurgical medicine, is that you can address many illnesses. This has been a part of the care for Parkinson's patients already. So it's something that's in the toolbox. But this toolbox is expanding where there's opportunity to treat other illnesses, neurologic diseases that had become very difficult to be able to manage. And this is where there's an opportunity for people to get their rehabilitation expedited if they've had a stroke. The other thing that is learned of this is that the electrical stimulation, which is neuromodulation, leads to neuroplasticity, which means the nerve and the brain parts start to have growth of increased activity in those areas, and it starts to become more efficient. And that's where the healing can happen for various illnesses. And this door that has opened is going to allow us to look at some of the most complex cases. Unfortunately, because of the experiences and the trauma that our veterans have experienced, whether it's post-traumatic stress disorder, neurologic injuries, or damages that they have had direct from trauma from nerves being affected and parts of the limbs removed and so on, there are opportunities for the brain, for the pain control, from the PTSD control to be looked at, and also the strokes that they are getting far more than the general population. So this is where, because the science cannot necessarily wait, but the funding is the critical part to it. And we feel that at University of Connecticut, we are fortunate to have a team of people who are able to initiate this. Some of this is FDA approved, not all of this is FDA approved. And if we move in this direction, there's an opportunity from the research to be able to showcase hopefully positive results so that more of this can happen. And this bill is going to give us that opportunity as an investment from the state to be able to help our veterans, but also open the door that may subsequently help thousands of veterans and all citizens going forward. But we need to open this door, and this research is going to open that door. And hopefully today with our vote to send this to appropriations, we will be part of that process. Thank you so much, Madam Chair.
Thank you, Senator Anwar. Senator Marks.
Thank you, Madam Chair. I had the privilege of sitting with Dr. Moore and the entire team that's trying to get this passed. And if I had a stroke, or anybody sitting here with our really good health insurance, we'd be able to go to UConn Health Center and get this therapy and be able to have much greater deficit reductions after a stroke than if we didn't have this therapy. But if you go to the VA, you're not going to get this covered. So this is just a way of, you often hear people in the VA will go to DC and say, we want your benefits. We want it, what the Congress people have. Well, this is a way of extending our benefits to some veterans who they could have had their stroke 20 years ago and still have deficits that by getting this therapy, it's going to improve it. It's also going to make our Yukon Health Center one of the most, the best in the country with this kind of treatment for strokes. We've come a long way with strokes. You know, when I first started in my career, you would have, you know, the neuro floor would have 4-bedroom, you know, numerous 4-bedrooms with just stroke patients in it. And that doesn't happen anymore. But those that do end up having deficits, this can really, really help. And we need to help our vets. The suicide rate isn't going down with a lot of things that we're already doing. So maybe this will just help a few more have a really good life afterwards, make it a little bit better. So I'm really excited about this, and I'm excited about getting the money in appropriations for it. I think that's going to be a much harder step than getting it through this committee. But that's what we're going to have to do. And I thank Rep. Jenga for all of his really hard work on this. So thank you, Madam Chair.
Thank you very much, Senator Marks. Senator Summers.
Thank you. I just had a couple questions. I just wanted to make sure that it's clear. We've been using language that people that are watching may or may not understand. So I just wanted to be clear on what we're doing. There's a $2 million ask to establish this neuromodulation treatment center at the University of Connecticut. And they're going to team up with Hartford Healthcare, which will care for the veteran patient afterwards. I heard the chairman say there are some things that are FDA cleared and not FDA cleared. So I just wanted to see if you could speak a little bit more to that. And also, currently, the VA does not cover these services because they do not have this kind of treatment at the VA. If the veterans are coming to the University of Connecticut, is the VA going to reimburse for that procedure, or is that procedure going to be free while they're collecting the information? Is this a study? You said there's more study that has to be done so that it can be rolled out. And also, you know, if I had a stroke, would I be able to go, or is it the pilot just for veterans? Can you just clarify all that? Because I think it's a little confusing for people that are listening, and I would love to be able to have the clarity that we need. Thank you.
Thank you, Senator Summers. Senator Anwar.
Thank you so much. Thank you for the question from our ranking member. So not all the procedures are covered or are approved by the FDA. Like I was saying, that this opening the door for an era that is going to be critical. But a number of things have been approved. To answer the question on the stroke, yes, it is covered. And but is it covered for the veterans? That the VA system does not have the ability to do this at this point. They may be able to allow someone to be able to do it, but that process is not clear at this time to be able to achieve that. But the funding is going to allow us to be able to have that center of excellence to be created. And starting from Yukon, from the neurosurgical department, and to be able to look at these cases who may not necessarily have that coverage to be able to take care of things.
Okay, so I just want to be clear, and I'm supportive of this bill, but I think it's important to clarify it. So if I'm a veteran, I'm getting my services at the VA, and they don't have this service, I can go to the University of Connecticut for this new treatment. Does the VA then reimburse the state of Connecticut, or is that part of the $2 million pilot?
It's part of the $2 million pilot.
Okay, that's very clear. And then if I am, so veterans will not be paying for this service. And that's fine. I just wanted to be clear. And that $2 million will be part of this pilot. And a non-veteran patient can also go if their insurance covers this for strokes, because that's been approved by the FDA. Is that correct? I just want to make sure we're clear.
I will try to relay what the surgeons and the Yukon team had said. Insurance is insurance, which means that they sometimes do, sometimes don't. The whole process is very difficult and almost impossible to do it. Well, it should be covered, but the hurdles are quite significant.
So is part of the pilot program to have veterans come in after a stroke so that we can create a white paper to prove that this is going to be the standard of care, let's say, for strokes, and then we can go try to get it covered by insurance. Is that part of the process that we're trying to do?
That will allow the team to be able to get to that point. Correct. Thank you for that question.
And do we have any idea if a patient wanted to go who has had a stroke, whether it be 10 years ago or 6 months ago, who is a non-veteran, what is the university, do we know if the university would take them if they pay out of pocket, or is that off the table?
I don't know the answer to that. I'm sorry.
No. Thank you for all those questions. I think this is for answers to all those questions. I think that this is an important bill. I think that Connecticut has always been supportive of veterans. We have, I know, especially in my district, I have a very large number of veterans, many of which have suffered from some of the things that Representative Jenga has mentioned. And I think it's an important step forward. I do think that it is interesting that Hartford Healthcare is going to be participating in this. Are they also part of the $2 million pilot, the care afterwards, or is that going to be absorbed by Hartford Healthcare for the veteran? I think that's important also. I'm sorry I'm asking all these detailed questions, but it's important.
A very valid question. In the bill, it's only for University of Connecticut. That is included in the bill.
So are we sure then that if we have these treatments for our veterans, which we all can agree are important, but if the veteran is under the VA care, if they're then going to go to Hartford Hospital, we heard between, I think, 5 and 10 days, where is that covered for them? So what I don't want to happen is have the treatment and then not be able to get the follow-up care that you need.
I can speak to the bill, and the bill is focused on University of Connecticut to get the funding. Now, as a part of the entire spectrum of treatments and post-treatment management, if the team of UConn has to work with any other entity, it is going to be part of that team's option to make that decision. And again,
Could try to work with the VA too. Have the treatment and go back to the VA hospital. That might work.
it's going to be their option for looking at what's the best place. And I think I will go back to my chair because I think there's others who have a question too.
Yeah, I'm just concerned about being on appropriations. I'm concerned, is there enough funding requested here? And we want to make sure if somebody does go through the process that they have the follow-up care that they need. And if it's not covered, how does that work? Because I don't want to have a half-baked pilot program, if that makes any sense.
No, and thank you, Mr. Chair, and thank you, Senator Summers. And I think just to clarify, the actual language in the bill does not specify Hartford Healthcare. It specifies on line 10, the health center, as in UConn, may collaborate with a hospital in the state because it's a private hospital. So we're not going to be able to write legislation in that way. We understand from hearing testimony as we did that is the current practice and the current plan. And I think your point is well taken in terms of also speaking with the folks at the VA. And I do believe that there are some at the health center who are interested in engaging in those conversations, because the idea is this is a pilot, as you said, being able to study, understand, create a standard that has already been demonstrated to have such incredible success, and then be able to expand that out. Thank you, Senator. Representative Jenga.
Couple of things for clarity. This bill involves 10 men and women who are veterans, and they're covered. Any individual who wanted to go to Dr. Connor, and I understand there are some, whether or not their insurance pays, they can go and get this procedure. It's available. But the monies for the 10 plus the research, all the criteria that's going to be done, and the collaboration with Hartford Health, as Dr. Setarama and Dr. Connor testified, they are going to be collaborating. The facility is available at UConn for the surgery, and the facility for the rehab is available at Hartford Healthcare immediately. I hope that clarifies some.
Thank you, Representative. Seeing and hearing.
Just say that made it a little more confusing for me. So if-
Senator Summers.
sorry. So the $2 million, if we can get it through appropriations, is for 10 veterans, 10 women veterans, 10 male veterans. Is that correct? No, just 10
men
veterans.
and women.
Okay, so
Yeah.
10.
Although the split.
And that would include the surgical procedure and the aftercare someplace.
And
So if
Okay.
I may, Representative Jenga, can you respond and use the microphone so that people can hear?
yes, it would, and the research.
Thank you. Seeing and hearing no other discussion on this, Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to add this item to the consent calendar.
Seeing and hearing no objection, this item will be added to consent. Moving on to item number 6 on our agenda, this is House Bill number 7156. This is an act concerning the Department of Developmental Services recommendations regarding various revisions to developmental services statutes. This is a JFS to the floor. This is LCO 6301. May I have a motion? Moved by Senator Marks. Is there a second? Seconded by Representative Belton. No, I believe I have, do I have the correct LCO number? Yes, LCO 6301. With a special thanks to our LCO attorneys for getting that latest addition to us. So the bill before us today does a few things that makes changes to the DDS statutes, including allowing the administration of epinephrine or insulin by injections by non-nursing staff for those living in DDS licensed or certified facilities, if that staff has training to do so. This allows an adult with intellectual disabilities, their legal representative, or the DDS commissioner or designee to petition for a guardian to be granted authority to manage financial affairs of up to $10,000 in assets. This expands the department's abuse and neglect registry to include a community companion home licensees whose licenses were revoked or surrendered due to abuse or neglect, or CCH, community companion home designees, against whom there's been a finding of abuse or neglect. It provides a process for a community companion home license under these circumstances to request a hearing to contest that license revocation. It makes information in the DDS Abuse and Neglect Registry available to the Office of the Probate Court Administrator. So this allows them to be able to have information when determining a guardian and when there's a proposed guardian on that registry so that they will know. And finally, this updates the statutory terminology from the DDS's Behavioral Services Program to Children's Services Program to more accurately reflect the work. The S language that we received today, and this was the updated S language to make sure that everyone on the committee has the most up-to-date language. We were able to make one more change this morning, but those changes are 3 things. One, it clarified that the administration of medication allowed under Section 1 is for the use of auto injectors for allergic reactions and diabetes care. It also changed the language regarding the guardianship. So per the testimony we heard from the probate court and DDS agreed to simplify that language to make sure that that we were very clear in who was able to do what and properly protected those who are being served. And that final addition this morning was an agreement that both the Hospital Association and the department have requested language to clarify medical providers' ability to provide information to release medical records to the department for use in mortality reviews. And again, that was an agreed upon change. And is there discussion on this item? Seeing and hearing none, Representative Clara DeStitria.
Thank you, Madam Chair. I'd like to add this item to the consent calendar.
Without objection, this item will be added to our consent calendar. With that, I believe we have come to our consent calendar. which has been properly moved and seconded. And I will read the items on the consent calendar before us. It's item number 3, Senate Bill number 1451, an act concerning the recommendations of the working group to study staff safety issues affecting home health care and home health aid agencies. This is JFS LCO 6259. House Bill number 6977, an act concerning the Department of Public Health's recommendations regarding drinking water. This is a JF to the floor. Item 5, House Bill number 70800, an act concerning neuromodulation treatments for veterans at the Yukon Health Center. This is a JF2 appropriations. And finally, item 6, House Bill number 7156, an act concerning the Department of Developmental Services recommendations regarding various revisions to developmental services statutes. This is a JFS LCO 6301. And with that, Mr. Clerk, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCrory, Senator Summers,
Summers votes yes.
Representative Claire DeStitria,
Claire DeStitria votes yes.
Representative Berger Giovanni, Representative Biggins, Representative Carpino,
Carpino votes yes.
Representative Dauphiné.
Rep. Dauphiné votes yes.
Can you do that one more time, Rep. Dauphiné?
Rep. Dauphiné votes yes.
I have it. You're good. Rep. D'Amico,
D'Amico votes yes.
Rep. Elliott, Rep. Jenga,
Yes.
Rep. Gilchrist, Senator Gordon, Senator Hockadell, Representative Cavros DeGraw, Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy, Senator Kushner, Representative Mara, Representative Martinez,
Representative Martinez votes yes.
Representative Morin-Bello,
Representative Morin-Bello votes yes.
Representative Parker. Oh, I think you're muted, Representative Parker. I see your lips moving, but I don't hear you. Sorry. I'll move on to the next one. Rep. Pauletta. Senator Rahman. Representative Reddington Hughes.
Reddington Hughes votes yes.
Representative Ryan.
Representative Ryan votes yes.
Senator Slapp. Representative Steinberg.
Representative Steinberg votes yes.
Representative Zupkus.
Yes.
Representative Parker, you want to try again? All right, we're all good. Oh, yeah, we're all good. Madam Chair.
Thank you very much, Mr. Clerk. And I just want to say thank you again to everyone today, especially to our wonderful attorneys and our public health committee team who is behind the scenes and helping us do this work. I will note that we have a public hearing on Monday, St. Patrick's Day at 11:30. And then we have our next committee meeting is scheduled for Friday, the 21st at 1:30. The votes will be held open until 3 p.m. up in the public online on Zoom and also in the Public Health Suite 3000. And I want to say thank you. And with that, we are recessed.
Can you guys hear me?
Yep, I can hear you.
All right. So Representative Morin-Bello, we'll start with you.
Great.
So item number 1, 1326, we had a roll call. How do you like to vote?
Yes.
And item number 2, SB number 1373, that was a roll call. How do you like to vote?
Yes.
And then item,
I voted
Three-
on the
Yeah,
consent
consent calendar.
calendar. So I think
Yeah,
I'm
the
all
rest of-
set, right?
yeah, you're all set.
Okay, thanks so much.
Next, Representative Carpino.
Thank you. I believe I only missed number 2.
On lactation consultant.
Correct. I'd like to vote no.
Okay, just let me make sure. Have you there? Now we can, yeah, you're all set.
Thank you.
Representative Parker,
How about now?
I can hear you now. Okay. Item number 1, SB 1326 was a roll call. How do you like to vote? You vote yes?
Yes.
Yeah.
I vote yes.
And then item number 2, SB number 1373, how do you like to vote?
Yes.
And then item 3, 4, 5, and 6 were on the consent calendar. How do you like to vote?
Yes.
Yes? Okay, you're all good.
Thanks, Peter. I appreciate you.
Yeah, no problem. Hey,
Peter,
okay, you ready?
I'm ready.
All right, so item number one, SB number 1326 was a roll call. How do you like to vote?
Yes,
And then item number two, SB number 1373 is a roll call. How do you like to vote?
yes,
And then items 3, 4, 5, and 6 were on the consent calendar. So how do you like to vote on the consent calendar?
yes.
Okay, you're all set.
Great, thank you.
Have a good one. Bye.
It is something else. You're watching Spring Training? Absolutely.
Hello,
Hello. Okay. Are you ready?
can you hear me?
Yeah, I can hear you. Can you hear me?
Um, why can't I hear you?
Oh, you can't hear me? Okay.
Huh.
The Dodger lineup. Last year, the lineup was unbelievable.
Hang on.
Mhm.
What about now?
Oh, testing. Can you hear me? 1, 2.
Yeah, I can hear you now.
Oh, you can hear me? Okay.
Okay.
All right. So are you ready?
Yes.
Okay. So item number one, SB number 1326, that was a roll call. How would you like to vote?
Yes.
Sorry if I haven't moved.
Item number two, SB 1373 was a roll call. How would you like to vote?
Yes.
They were relying
And
on
then items 3, 4, 5, and 6 were on the consent calendar. So how would you like to vote on the consent calendar?
Yes.
Okay, you're all set.
Thanks so much.
Have a good one.
You
Bye.
too. Sorry,
Okay.
Peter. Thank you.
No, it's all right. Yeah. So item number 1, SB number 1326 was a roll call. How do you like to vote?
In the affirmative? Yes.
And then item number 2, SB number 1373, that was a roll call. How do you like to vote?
Yes.
And then items number 3, 4, 5, and 6 were on the consent calendar. So how do you like to vote on the consent calendar?
Yes.
Okay, and you're all set.
Sweet.
Yeah, have a good one.
Thank you.
Yep.
Hello, how are
Good
you?
afternoon. Good afternoon, Representative. Okay.
Okay,
You all ready?
I am ready.
Okay. So item number one, SB number 1326 was a roll call. How do you like to vote?
Yes, please.
Item number two, SB 1373 was a roll call. How do you like to vote?
Yes, please.
And then items 3, 4, 5, and 6 were on the consent calendar. So how do you like to vote on the consent calendar?
Yes.
Okay. You're all set.
Okay, thank you so much. Have a great afternoon and weekend.
You too. Bye.
Bye. Yeah, CVS, and then this is going.
Okay. So I'll do Representative Gilchrist first because I'm only missing you for, I think, 2. Let me just make sure. No, I think I'm only missing you for the consent calendar.
Okay,
So,
wonderful.
yeah. Items 3, 4, 5, and 6 are on the consent calendar. So how do you like to vote?
I'd vote yes. Thank you.
You're all set. All right.
All right, have a good one.
Thank you. And then Senator Hockedal.
Yes, I am here.
Okay. So item number 1, SB number 1326 was a roll call. So how do you like to vote?
Yes, please.
Item number 2, SB 1373 was a roll call. How would you like to vote?
Yes, please.
And then items number 3, 4, 5, and 6 were on the consent calendar. So how do you like to vote on the consent calendar?
Yes, please.
Then you're all set.
Thank you.
Yeah. Have a good one. Bye.
You too.
Here. Hey, good afternoon. Oh.
Sorry, how are you?
I'm good. I'm good. I'm good.
Good.
Are you ready?
Yes, yes. So first, before you started,
Mhm.
tell me anything both chair said no.
No, they all voted yes on everything.
All said yes. Okay, let's do that.
Okay. So item
Because
number one,
the bill, you know.
yeah. So item
Make-
number one, SB number 1326 was a roll call. How do you like to vote?
Yes,
Item number two, SB number 1373 was a roll call. How do you like to vote?
yes,
And then items 3, 4, 5, and 6 were on the consent calendar. So how do you like to vote on the consent calendar?
yes.
Okay, you're all set.
Awesome. Thank you. This is very easy peasy.
Yeah.
Yeah. You take care. Thank you.
You too. Have a good one. Okay. So RC is roll call and CC is consent calendar.
So we'll call,
Item. So for item number one, how do you like to vote? Item number two, how do you like to vote?
yes,
And then items number three.
everything else is, yes,
Okay, all right, I got you. Yeah,
I appreciate it, Peter. Thanks for coming.
that's no problem. Have a good one.
Hi there.
Hi, okay. You ready?
Yes.
Okay. So item number one, SB number 1326 was a roll call. How would you like to vote?
Yes.
Item number two, SB 1373 was a roll call. How do you like to vote?
Yes.
And then items 3, 4, 5, and 6 were on the consent calendar. So how do you like to vote on the consent calendar?
Yes.
Okay, and you're all set.
Thank you so much. Have a great day.
Okay, you come back. Mhm. Okay. So for, if you're ready. Yeah. Mhm. So item number one, SB number 1326 was a roll call. How do you like to vote?
Yes.
Yes. Item number two, SB 1373 was a roll call. How do you like to vote? No. And then items 3, 4, 5, and 6 were on the consent calendar. So how do you like to vote on the consent calendar?
All 3, 4, 5, and 6?
Mhm.
Yes.
Okay. And you're all set. Have a good one. Yeah, no problem.
Have a good
No. No.
Good afternoon. Oh. Hello, can you hear me?
Yes, I can hear you.
I can hear you. Are you ready?
Yes.
So item number 1, SB number 1326 was a roll call. How do you like to vote?
Yes.
Item number 2, SB 1373 was a roll call. How do you like to vote?
Sorry, wait, which one was that?
Item number 2, SB number 1373, an act requiring the licensure of lactation consultants.
No.
And then items number 3, 4, 5, and 6 were on the consent calendar. So how would you like to vote on the consent calendar?
Yes.
Okay, you're all set.
Thank you so much. Have a good day.
You too. unmute. So item number 1, SB number 1326 was a roll call. How do you like to vote?
Kennedy, no.
And then SB, or item number 2, SB 1373, it was a roll call. How do you like to vote?
Kennedy, no.
And then items number,
4, 5, 6.
Yeah.
Yeah.
okay, all right, you're all good.
Thank you.
Yeah, have a good one.